Good morning, everybody. Thank you for coming out. I had the honor and the privilege of sitting in on the DMAC meeting today. I started off the meeting with Chief Scott talking about how grateful I am, and this is a sign and a signal of the ability when you cooperate and you collaborate and you bring departments together, you can have successful outcomes. And I applaud the people in that room upstairs who are still meeting on the progress that they have made. But as we all know, JD and I just walked 6th Street yesterday. We have a lot of work to do. And that's why last week on day one, we announced that we can no longer treat this fentanyl crisis like a 9-to-5 issue. This is a crisis that happens 24 hours a day. The department heads and the law enforcement officials behind me understand that, and we are working on that. Yesterday, we introduced a fentanyl state of emergency ordinance. We started off with 4 co-sponsors. We've added another one today. I am really appreciative of the board members behind me and the entire board for considering that and pushing for a quick approval of that over the coming week. And so we have a crisis that needs the urgency. It demands urgency, and that's what you're seeing from my administration and everybody behind me. And so I really want to thank all the officials here for your commitment. I want to really shout out our U.S. Attorney, Izzy Ramsey, for his incredible work as well, our DA, Brooke Jenkins, our sheriff, our police chief, for their incredible work. But as we all know, we have a lot more to do. So with that, Supervisor Dorsey.
Thank you. Thank you, Mayor Lurie, and I just want to welcome everybody to District 6. This is my district. It's also my neighborhood. You know, it was the convergence of a public health crisis and drug overdose deaths in my own journey in recovery from addiction that moved me to ask for a job on the Board of Supervisors that, candidly, I never thought I would want, let alone have. But I want to express my gratitude to Mayor Lurie for endeavoring to bring solutions as big as the problem. I do not believe there is a problem facing San Francisco today that isn't either wholly caused by or made significantly worse by street-level drug addiction, and by far fentanyl is the biggest culprit. This one drug, this potently addictive drug, is driving a public health calamity that is virtually unprecedented. In terms of loss of life, only the AIDS crisis surpasses it. We need big solutions and big ideas and a level of cooperation that really isn't something cities are good at, but I really appreciate the mayor for organizing not just the city departments, but his own office, where I think the job of identifying silos and breaking them down and surging resources effectively belongs in the executive, and I'm really encouraged by Mayor Lurie's leadership. And I am, when I was briefed on this, I asked if I could be the first co-sponsor. And I'm grateful that I was. Thank you so much.
Appreciate it, sir.
Hi, everyone. I'm Bilal Mahmoud, the new supervisor of District 5, which encompasses the Tenderloin. This is a crisis that I campaigned on as making a priority on day one. I'm honored to partner with Mayor Lurie and the supervisors here as well on treating this like the crisis that it is. I live just across the street, and I know every day the community in the Tenderloin, the children, the families, the seniors, the refugees, the immigrants have talked about how they don't want to be walking past drug dealers on our street during the day, during the afternoon, or during at night. And I heard during the campaign that what we need to do to solve that crisis is to make sure we had a fully staffed police department, fully funding efforts to coordinate law enforcement and city departments together and ensure more community collaboration. And I talked to Mayor Lurie about that once we were elected and talked to them about this department of the Drug Market Agency Coordination Center, which is a shining example in City Hall of coordination between departments. There is not any other department that I know of in the Tenderloin where people know the commander, the captains, the department heads on a first-name basis, aside from the Drug Market Agency Coordination Center, or DMAC, because of their community engagement, because of their commitment to solving this crisis. And it is about SFPD working with DPW, the Sheriff's Department working with DPH, collaborating, and a shining example of this consensus that we're driving forward. And I want to, again, thank Mayor Lurie now for ensuring that we are committing to ensuring that DMAC is a permanent entity in this office, but also fully funding and expanding its services so we can fully end the open air drug market that we see on our streets. And I know that by continued community engagement and the ordinances that we introduced yesterday at the Board of Supervisors on behalf of the mayor, we will ensure accountability, because the best way to ensure accountability and oversight of our police efforts is to ensure the continued community engagement and the measures that the mayor has introduced to drive this and to fully shut down the open air drug market in the years ahead. So thank you all for being here, and thank you again, Mayor Lurie, for this.
Appreciate it.
Good morning. Thank you, Mayor Lurie, for bringing us together, for taking swift action on this. My name is Danny Sauter. I'm the District 3 Supervisor, and I have the incredible honor of representing neighborhoods like Chinatown, Union Square, Fisherman's Wharf, neighborhoods that are incredible but are hurting, that need help and need support. And there is no way to do that. There is no way to bring that foot traffic back, our businesses back, unless we get a handle on what's happening on our streets. And that is what this effort is all about. I am proud today to add my name as a co-sponsor on this package. This package is a way for us to commit to make sure that bureaucracy does not get in the way of saving lives on our streets, does not get in the way of shutting down the illegal selling of goods that we see, the markets that are popping up in San Francisco. The voters, the residents, the tourists of our city want San Francisco to come back. They're asking for action, and that is what this delivers. It is a good step forward. It is the right step, and it is a pledge from those behind me that are working hand in hand every day to coordinate these resources and to take swift action. So I applaud their efforts. I'm proud again to join on this bill to make sure that we have a true state of emergency, a fentanyl emergency package, and that we continue to make progress in San Francisco. Thank you.
Thank you, Supervisor. Appreciate it.
Good morning, everyone. As you know, I'm District Attorney Brooke Jenkins. I am honored to stand next to our new mayor, Daniel Lurie, today in what represents yet another strong partnership between my office, law enforcement, and City Hall. What I appreciate about Mayor Lurie is that he's been willing to sit down with us as department heads, as leaders in this city, understand from us what we believe is working, but also what we believe is not working, to improve the conditions on our streets. And one thing that I emphasized to him even before he was sworn in was the effectiveness of the Drug Market Agency Coordination Center. And he took that into account, and he has pledged not only to maintain this effort and this cohesive strategy, but that he will have a more significant presence at the table as we discuss the issues that need to be resolved. And that is a commitment that I just have to say that I am thankful for. I think it is important that the head of this city be present during the discussions that go on between department heads, because oftentimes we do not agree. Oftentimes we have different perspectives, and we need to have the leader of our city in the room to flush out what he truly believes is the best way to manage the crisis that is on our streets. I do applaud you, Mayor Lurie, for also coming in and, as you promised on day one, pledging to seek through this or push through this legislation. We have to do something more bold. We have to give ourselves more leverage to attack this crisis. So much has been on the shoulders of law enforcement, but we have to make sure that we're doing the other things that help people get off of the street, that allow us to have more avenues to get people into treatment, and we have to ensure that we have the tools that we need to get that job done, and that is what you are seeking to do. And so I hope and pray that politics does not get in the way of progress at the Board of Supervisors, that they understand that we have a commitment not just to an individual district, but to this entire city to get this crisis under control so that our city can rebound, so that we no longer have to hear from voices like Elon Musk and others who want to continue to attack our city. We need to be able to demonstrate that when problems occur in San Francisco, that we can solve them. And that is what I know our mayor and everybody behind me is committed to do. And so I just thank all of you for your partnership, and I know we'll get it done.
Thank you, District Attorney. Okay. Couple questions.
Yeah, we got a quick minute.
Yeah.
Wondering if you could just outline how the state of emergency would broaden powers. What does that mean in terms of your ability to leverage assets?
It's really about contracting, surging resources, making sure we can hire people more quickly. As the DA said, I think it's a really important point. This is not just a law enforcement issue. This is a behavioral health issue, and we need to stand up more mental health beds, more drug treatment beds, and that's what this ordinance is going to help us do, and it will help us move more quickly. That is the point of this.
Yeah, how are you going to pay that? Hold on, we're going. Okay, go ahead.
Mayor Lurie, I know part of the ordinance language says that you could seek out donations from groups related to these specific issues. Are there any groups or individuals that you have in mind yet? And
haven't gotten into details on that front. We're working right now with the Board of Supervisors to make sure that this gets passed, but I do know that people want to help. They are, just like all of us behind us, committed to finding solutions, but have not talked to anybody in particular.
And quick follow-up, what's your, I guess, response to, I've seen Supervisor Chan, for example, has concern about the board not approving some of those?
Listen, as I said, I'm going to work with all 11 supervisors. Supervisor Chen and I spoke this morning about her concerns. Our teams are talking. I respect every one of our supervisors, and I know that we're going to work well together, and I look forward to working with Supervisor Chen on this and other issues as well.
Mayor Lurie, one of the powers you're asking for is to be able to seek private charitable donations, right? Do you view that as a temporary thing, or do you view that as something that the mayor's office should be able to do in the long term?
I think this is focused on this effort to stand up treatment beds, more mental health beds. What I am asking for is focused on the fentanyl emergency, not beyond that.
Last one here, Mayor Lurie.
There was a question. Sir, I'm going to call on the question. You have the last one here.
Have you thought about where the new facilities will be?
We're going to work with neighborhood groups. That's the focus of making sure that we work with neighborhood groups before citing anything. But there are groups and locations that we could stand up quickly. We could add beds to. We have existing hospitals that there is space. For instance, at SF General, there is space for more beds. What I talked about on the campaign trail and what we all know, it's not just about beds, it's also about staffing. And this ordinance will help us staff up more quickly, get people hired and on the job more quickly.
Okay.
Thank you all very much.
I'm sorry, we got to run. Chan specifically was about the oversight of contracts. Can you talk about that a little bit? And is it
actually it was not. She was more about the timing and the length of it, and so our offices are in talks about that. But this is not something that we need 6 months on. We need years of help on this with this ordinance, and we are going to work not only with her office but with all 11 supervisors. I'm committed to working with them. But having said that, this is what I ran on. I got a mandate to deliver, and the first thing we talked about was public safety. The second was the fentanyl state of emergency. And I am really honored that we have 5 co-sponsors already. We are going to get this passed, and I look forward to working with all the supervisors to do that. Thank you all very much.